born in Richardson Park, Wilmington, Delaware. My parents were both physicians. My mother was a doctor, a general practitioner. My father was a general practitioner, then he became a board cardiologist, one of the first in Delaware. They practiced for 30 years in Wilmington, and then in 1955, they ended up as missionaries in Kathmandu, Nepal. They got there very early in that country and started one of the first hospitals in Kathmandu. I was about 6 or 7, and I didn't think there was anything else to do except medicine. And it always made it easy for me. I always knew I wanted to be a surgeon. As a bit of advice, if you know early in your career what you want to do, it makes it a lot simpler because you don't have many choices to make. You just decide, well, you have to go to college, then you have to go to medical school, then you have to be a resident. And so it just fit, and it was never a problem. I just knew what I wanted to do. The day I was the smartest ever was the day I graduated from Harvard Medical School. The next day when I was an intern, I didn't feel so confident. And it's been like that ever since. The day you're out of medical school, you know. But then you find out life isn't like that. And at Harvard, at graduation, we had a wonderful dean. He said, "Gentlemen," he said, "you're going to the finest medical school in the country. And half of what we've taught you is correct. The other half is not correct. It is up to you to decide which half is correct." And that is life. There's not that much laying on of hands that physicians really we started with. And I've just noticed with the training that residents kind of go into intensive care units and kind of read all the charts and look at all the graphs, and they don't even touch the patient, and they say, "Well, you're doing fine." But there's a lot more to medicine than that. I believe in all the technology and everything, but I think time to sit down and talk to people, and, ask them what really the problem is. The problem today is that the insurance carriers don't pay for a physician to sit down and talk to you. They pay for tests. They'll cover that. And we just need to spend more time with people. I was taught in medical school that if you spent time with patients, really ask them everything, 80% of the time you can make a diagnosis. It's all reversed today. It's all backwards. It's all the different way around. And the tests and everything, CAT scan, MRI, you get all that. And it just seemed to have reversed. And they'll probably, well, the pendulum will probably swing back somewhere. I think people ask for it, really. At the hospital in Kabul, the intensive care unit, I'll never forget that. It was just a room about this size with 4 cots with no sheets in the bed or anything. And that was their intensive care unit, and no running water in it. It had one light bulb. And one time, we operated on this patient. We had a colon resection and had a nasogastric tube down, which you put down after the operation. And the night before, a patient came in with a perforated bowel from typhoid. We saw several cases of typhoid. And the patient didn't have a tube down. And I really lit into the resident. I said, this patient came in last night. He didn't even put a tube down his stomach. We didn't have one. I said, "No, you've got to have a tube." So I went to the next patient. While I was standing there, they went to my first patient, pulled the tube out from him, and just stuck it down the other patient. I mean, they just didn't have equipment. I spent the month there, one major lesson, to get them to wash their hands. Now, they didn't have any water in this intensive care unit, but they were very good carpenters. We had them build a wash stand and a basin and pitcher, and so they would go from one patient go wash their hands, and then go to the next patient. That's what I tried to do for the month. They were little things that we're trying to teach there. We take it all for granted here. I had started practice in 1961, and we had 4 hospitals. My primary hospital was in Memorial, and then the merger came, and the 3 hospitals, Wilmington General, Memorial, and Delaware merged. And whenever anything merges, what happens? When something merges, something grows, and the other things die. And that's exactly what happened. They blew up the Memorial, and they blew up the General, and the Delaware Hospital grew up. And then, of course, then ended up coming down here to the Christiana. So I was in private practice all along. I ended up being president of the medical dental staff for about 4 years. That's the last time that they had a president for 4 years. There was just 2 years now, and it was kind of a volunteer thing. And I was president of the Academy of Medicine for a term. The highlight of that experience was I think 1985. And when I was president, we had a conference. It was during the Cold War, and we really couldn't talk to the Russians. So we set up a conference with some Russians and a group called Physicians Against Nuclear War. The conference was held at the Opera House down here. We had probably 600 or 700 people came to this conference. The Russians came from Russia. They were physicians who were against nuclear proliferation. As a matter of fact, the night before the conference, they ended up at our house. We wanted to have a American barbecue for them. And I guess there was a little too much vodka from everybody, but they were, by the time they're over, we say, my heart beats like your heart. My grandchildren are like your grandchildren. It was a very personal kind of thing. And it was a very successful thing that the Academy sponsored. And as a matter of fact, that year, that group, the Physicians Against Nuclear Proliferation, Nuclear War, got the Nobel Peace Prize for the Peace Prize. So that was sort of the highlight of my presidency when I was at the Academy here. Well, it's pretty confusing originally about the Academy because a lot of young physicians came and they didn't know what the Academy was all about. But it's Dr. Lewis Flynn who really had this concept. See, they had the 3 hospitals and they had no place to really meet that was neutral ground. That if you went to a specific hospital, the group from the General, there'd be physicians at the Wilmington General, physicians at Memorial, and we were all in different staffs, but there were certain groups that wouldn't go with each other. So Dr. Lewis Flynn got this idea of the Academy, and then the Academy building was an old bank building down from Market Street. They moved up, you know, brick for brick, with timbers and everything, up to Lovering Avenue. And it was a wonderful old building. It was an old building. My tenure there was to, beside this meeting, was to try to keep the roof from leaking, to keep the furnace going. There's a lot of overhead in an old building. But that was why it was set up. And we always had trouble getting younger physicians to understand the difference between the Medical Society of Delaware, the State Medical Society, and the Academy. So the Academy was a neutral meeting ground, and there were informational conferences, and one of our problems, we couldn't keep up with all the technology. We didn't have good enough projector. We didn't have slides, didn't have computer things. And so when the merger came up, I remember we used to have these meetings. Well, first you'd have a meeting at the Delaware, and a meeting at the General, meeting and decide whether to do this. But the common ground to go to in the big conference was at the Academy. because then the three groups would come together, and that's where we discussed it at the academy, because that's a neutral place, and it served a great function.